Today we are going to start symbiotic drugs. As you mentioned last lecture that symbiotic drugs are um, classified into sympathetic agonists or stimulants or sympathomimetics and sympatholytics. Today we are going to deliver to sympatholytics or sympathetic inhibitors or antagonists of sympathetic nervous system. They call them blockers. Blockers of sympathetic nervous system. So sympatholytic drugs, many drugs that are effective by blockade of receptors directly on the receptors, alpha or beta, or mixed alpha and beta like labetalol, alpha blockers like phenoxybenzamine, prazosin, doxazosin, and beta blockers. Some sympatholytics do not act on the receptors directly, but they are adrenergic neuron blockers. They antagonize sympathetic nervous system through inhibition of norepinephrine, and we call them adrenergic neuron blockers, or centrally acting sympatholytics like clonidine and alpha methyl dopa. They act centrally by producing impulses from the brain to the peripheries to the sympathetic in the peripheries to be inhibited. So this will lower the blood pressure. They are used as hypertensive drugs. Directly, as you see, directly acting drugs, they stimulate or they block uh, the receptor sympathetic nervous system, either alpha or beta. Other alpha blockers, they can cause vasodilation like prazosin, doxazosin, terazosin, tamsulosin. They are used as a hypotensive agent in hypertensive patients, and also they are used for treatment of benign prostatic hyperplasia as medical treatment to prevent the risk of surgery for these old people with benign prostatic hyperplasia. So in combination with finasteride, which reduce the conversion of testosterone to dihydrotestosterone, uh, in combination with uh, alpha reductase inhibitors like finasteride. So prazosin, doxazosin, one of them can be selected to treat benign prostatic hyperplasia in old males. Phentolamine is non-selective. It acts or blocks both alpha 1 and alpha 2 phentolamine. The main effects due to blockade of alpha 1 receptors on cardiovascular, they can cause palpitation, adverse drug reaction, hypotension, tachycardia, edema, arrhythmia, and chest pain. On CNS, dizziness, headache, and anxiety, vertigo, weakness, numbness, and fatigue. Also, anxiety, they can cause diarrhea, abdominal pain, or abdominal disturbances, constipation, diarrhea, vomiting, and nausea. Beta blockers are classified into cardioselective ones and non-selective beta. Selective beta adrenoreceptors block beta 1 on the heart selectively. Others, like propranolol and other pindolol, nadolol, oxprenolol, satolol, these are non-selective beta blockers. What's the significance of this classification? The significance of this classification, we have to put in mind that diabetic patient treated with insulin on oral or oral hypoglycemic drugs, so they can suffer from hypoglycemia, and hypoglycemic shock may develop when we give when they are given non-selective beta blockers like propranolol. So to prevent this, we have to select that are effective in beta blockers that are active on beta 1 selectively on the heart, and also bronchospasm. Blockade of beta 2 can lead to bronchospasm, especially in asthmatic patients. So they are not recommended for asthmatic patients or in patients that are treated with diabetic patient treated with insulin or other oral hypoglycemic drug. This is the significance of this classification. So they are cardioselective or non-selective beta blockers. Well, some beta blockers are used for reduction of aqueous humor, so they are reducing aqueous intraocular tension for treatment of glaucoma, like timolol, bafenolol, betaxolol. These are beta blockers used for reduction of formation of aqueous humor, consequently reducing uh, intraocular tension. This is the mechanism of action. They decrease heart rate, myocardial contractility, prolong SA node recovery, slowing conductivity. So some of them are used for treatment of some arrhythmias, cardiac arrhythmias. Non-selective beta blockers or non-specific, they are used for cardiovascular. They can be used also. They can cause narrowing of airways, as we mentioned, blood vessels. They can cause vasoconstriction on bronchioles, constriction also. So, what are the therapeutic uses of beta blockers? Anti-anginal, antihypertensive on cardiovascular system, and also class 2, because they are classified as class 2 antiarrhythmic, also as anti-anxiety in combination with antithyroid drugs in thyrotoxic patients, because in these patients the receptors are super sensitive to catecholamine. So beta blockers must be blocked to prevent MI, myocardial infarction. Antihypertensive also for treatment of migraine, headache, for glaucoma, as we mentioned. Uh, Timolol, bafenolol, betaxolol are used for glaucoma, reducing aqueous humor, in combination with digoxin for treatment of heart failure. As it is known that beta blockers alone are contraindicated in patients with heart failure because they can cause heart failure. So in combination with digoxin, they can be used because they reduce the heart rate, and digoxin also reduce the heart rate in failing heart. And this will improve the cardiac performance in patients with heart failure. The main adverse drug reactions: agranulocytosis, thrombocytopenia, they block AV nodal conduction, also congestive heart failure, they can cause dizziness on CNS, mental confusion, and sometimes due to hypoglycemia, muscle weakness, impotency, rash, alopecia, bronchospasm. All of these are muscle cramp. It may be due to the hypoglycemic effect of beta blockers. These are the main adverse drug reactions. So also we have to assess the patient for chronic obstructive pulmonary disease or hypertension or cardiac arrhythmia, bradycardia, congestive heart failure before giving uh, beta blockers, or they may be contraindicated in these cases or not. Also, precautions: alpha receptors may precipitate hypotension, postural hypotension, according to the position, or Ferris dose, what is known as Ferris dose phenomena, bronchoconstriction, all of these. Also, some interactions with over-the-counter drugs or over-the-counter medicine, over-the-counter medications, aluminum hydroxide, antimuscarinic drugs or anticholinergic drugs, diuretics sometimes, oral hypoglycemic agents. So we have to put it in mind. The hypoglycemic shock may be developed when hypoglycemic drugs are administered at the same time or concurrently with beta block. So you have to advise the patient to take the medications at time, also to uh, to advise the patient to change the position. As you mentioned, they can cause postural hypotension. To change the position slowly to develop rapid hypotension or postural hypotension. Caffeine must be reduced. Alcohol is contraindicated or hazardous with beta and so on. So some precautions to beta blockers must be signs must be noticed or must be monitored. Some signs: the increase in weight, edema in the feet, shortness of breath, syncope. All of these cases must be monitored in when during therapy with beta blockers. Fatigue, hypotension, tachycardia, bradycardia, heart block, or congestive heart failure also